How to understand your kidney blood test results. Imagine trying to get a clear picture of how well your kidneys are working just from a few simple blood tests. It might seem complicated at first, but understanding what these numbers mean can really help you stay on top of your health. When your doctor orders blood tests for your kidneys, they usually look at several key things. These include estimated glomerular filtration rate, serum creatinine, blood urea nitrogen, and urine albumin to creatinine ratio. Each of these gives a different piece of the puzzle about your kidney health. The estimated glomerular filtration rate, or eGFR, is like a score that shows how much your kidneys are filtering waste from your blood. A normal eGFR is 90 or higher. If it drops between 60 and 89, it might mean your kidneys are working a little less efficiently, but it can still be normal if there are no other signs of trouble. When the eGFR falls below 60, it could indicate chronic kidney disease. And if it drops below 15, that's a sign of kidney failure, which needs urgent medical attention. The eGFR is calculated using your serum creatinine level along with your age, sex, and body size, so it's a helpful overall indicator. Serum creatinine is a waste product made by your muscles. Normally, your kidneys filter it out. If your creatinine level is high, it might mean your kidneys aren't filtering well. Normal levels are usually between 0.6 and 1.2 milligrams per deciliter, but this can vary slightly depending on your lab. Keep in mind that factors like muscle mass, diet, dehydration, or medications can influence creatinine levels. If your creatinine rises over time, it could suggest your kidney function is worsening. Blood urea nitrogen, or BUN, measures nitrogen from protein breakdown in your blood. Normal BUN levels are roughly between 7 and 20 milligrams per deciliter. Elevated BUN can happen if your kidneys aren't working well, but it can also be caused by dehydration, eating a lot of protein, or gastrointestinal bleeding. Because BUN can be affected by many things, it's best to interpret it alongside other tests like creatinine and eGFR for a clearer picture. The urine albumin to creatinine ratio, or ACR, looks at how much albumin, a type of protein, is in your urine. Normally, very little albumin leaks into urine. An ACR less than 3 milligrams per millimole is considered normal. If it's between 3 and 30, it suggests moderate kidney damage. Above 30 indicates more significant damage and a higher risk of kidney disease progressing. This test is especially useful because it can detect early kidney problems even if your eGFR is still normal. When your healthcare provider looks at all these results together, they can determine how advanced your kidney condition might be. For example, they can stage chronic kidney disease from stage 1, where there's some damage but normal filtration, to stage 5, which is kidney failure. They also consider ACR levels to see how much protein is leaking, which helps guide treatment and monitor progression. Other blood tests like checking your hemoglobin, white blood cells, platelets, and albumin levels can also give clues about complications from kidney disease. For example, anemia is common in advanced kidney disease because the kidneys produce a hormone that helps make red blood cells. It's important to remember that these test results don't tell the whole story on their own. Factors like hydration, diet, medications, and muscle mass can influence the numbers. That's why it's essential to discuss your results with your healthcare provider. They can interpret what these numbers mean for your specific situation, recommend any further testing, and help you develop a plan to protect your kidney health. In cases where kidney cancer is involved, these blood tests are often used to assess how well your kidneys are functioning before any treatment begins. This helps doctors choose the safest options for you and understand your overall health status. Knowing what your blood test results mean can empower you to stay informed and involved in your health care. Regular checkups and open conversations with your doctor are key to catching any issues early and maintaining healthy kidneys for years to come. Always seek personalized advice from your healthcare provider to get the most accurate understanding of your kidney health.